Now for the next up, we want to actually look at what is known as investigations of gynecological conditions. Investigations of gynecological conditions. So of course this one we just want to have an introduction to the whole concept. Do you understand? So gynecological conditions, we're just trying to say these are issues that affect women. These are issues that affect women. Okay, these are issues that affect women. So investigations is, I'm just trying to do all the possible tests, all the possible, using all the possible diagnostic modalities as applied to the condition that I'm suspecting from my history taking and what physical examination. So I want to further confirm it. So it involves a structural approach. It combines clinical evaluation, laboratory testing, imaging, and specialized procedures. So there are some foundational tests used across a wide range of gynecological complaints. Now initially I might actually want to take the history, so I'm trying to know more things about the woman. Okay, of course this will now help to tailor my mind towards what is wrong. So the menstrual history, the obstetrics history, all right, the sexual history, the symptoms. As you see having any issues, all right, then you go for pelvic examination. Then next I might now still want to go into laboratory tests. Okay, complete blood count, ESR, that's erythrocyte sedimentation rate, hormonal profile, serology. So urine tests too, like all those routine urinalysis, pregnancy tests. Then I also do some cultures to dictate urinary tract infections. Then for cytology and microbiology, I'm doing all those pap smears. I'm doing human papillomavirus tests. All right, I'm trying to culture. I'm trying to do sensitivity for what vaginal swabs, also for cervical swabs. Then imagings. If I now suspect that maybe there is like a tumor growth or maybe there is any issues in the pelvis, I might want to do ultrasound, which could be transabdominal vagina, evaluate the uterus, the ovaries, and the endometrium. Okay, then MRI and CT scans, then also sonohysterography. Okay, all of this I'll actually need to do them. Okay, so you can see that this one is kind of like a colposcopy, where they can use it to actually observe inside the vagina right into the cervix. Okay, so specific investigations by conditions. Now abdominal uterine bleeding can be used. The investigations for it could be endometrial biopsy, pelvic ultrasound, or hysteroscopy. Do you understand? So I'll just be talking about be calling the name of the words investigation, while you will now pause to actually look at the targeted, like I'm talking about the condition, then you pause to look at the targeted investigation. So pelvic pain, those are the investigations. Infertility, you have it. Vaginal discharge, you have it. Menstrual irregularities, you have it. Suspected cancers, that's suspected malignancies, you also have that. Postmenopausal bleeding is there. Suspected endometriosis is also there. All right, so you see all of them. Okay, so we'll still have special lectures which we are talking about all of them. All right, but that's in a short time to come. So those are the various investigations you might actually want to do for gynecological conditions.